Jane, I want to thank you so much for coming on the program today. We have quite a history together. And if you can, I want you to tell me what brought you into the office. What problem were you having?
I was having a problem with my knee.
Okay.
What happened was I twisted it, and then I got a torn meniscus from that, which I didn't know at first. I had to go to an orthopedic surgeon and have surgery, which was successful, but the initial injury caused a lot of swelling, a lot of pain, very acute pain, and I couldn't walk. I couldn't put any weight on my knee, so I was hobbling around with crutches. And once I went through the surgery, a lot of the acute pain went away. But of course, they want you to go on painkillers, which I was.
Did you go on them?
I didn't, because I really try to avoid any kind of medication if I can.
Okay.
But it was sore, and I couldn't, walk or stand for any length of time. And then I got through the 6 weeks period, and I do have a part-time job where I stand.
Right.
Work about 15 hours a week. And I was able to go back to work, but I had a knee brace.
I got you.
And by the time I would get off work after 4 hours of standing, my knee would be so swollen that the knee brace was like constricting me. I had to go home, elevate my leg, and put ice on it. But I bared through the pain.
I remember you coming in the office because I was treating you for your neck and back.
And lo and behold, when I got through the healing process, you came up with the Trigenics treatment, and
Right.
you gave me one treatment, and it was still painful at first,
Right.
but the pain went away, but the movement was tremendous. I could actually do a squat, and prior to that, I couldn't even bend my knee. Just sitting in a chair like this with my knee bent was painful. Right. So what that did was it enabled me to, because they encouraged me to do physical therapy, which I did some limited, but I couldn't do very much. So this enabled me to exercise, which I needed to continue the healing process.
Right.
And I joined a gym and got a personal trainer, and now I go 3 times a week, and
Right.
I've continued this. Now this, your original treatment was in December
Right.
of last year, and I followed up with another treatment last month, and I can do almost anything. I went back to my job, and I have minimal swelling. I mean, sometimes if I'm on my feet a real long time, but it's nothing. I don't have to wear a knee brace. I can walk. I just went on vacation last month to Illinois and saw my 2 grandchildren, and they ran me around for 2 weeks. So it really improved my, my life, the quality of my life.
That's awesome. And do you remember the first time when you came in and I said I have a technique, a non-surgical operation that I want to do on your knee? Do you remember how hesitant you were?
Well, sure, because there's always doubt. It's like,
Sure.
I had no idea what you were talking about. And, we're always skeptical,
Sure.
Especially when you get to be my age, you're a little skeptical when some young man says he's going to, do this and that to your knee. And I was in a certain amount of pain, not as bad as it was in the beginning, but I'm like, I don't think I want you to touch my knee. Just stay away from it,
And how long did that first treatment take? That you show that dramatic improvement? How long would you say?
It was immediate. I was in shock, really, that I had so much relief that quickly. It just blew me away.
Excellent. Can you do me a favor? And there could be people out watching right now that are experiencing chronic degenerative knee pain, and they're either faced with a replacement surgery or they're taking pain pills and getting injections, because those are the people that I see that aren't successful with the replacements or the injections or the pain pills. The people that have success and their pain's relieved, I don't see them in my office. So if you can look at, I believe it's that camera, and just tell anybody that might be experiencing pain and can't get it resolved, what would you recommend that they do?
Well, I would certainly recommend they try this treatment. When I did have my surgery, they went in and they even gave me the copies of the pictures of what's in my knee, because nowadays they put the little cameras in there.
Right.
And I'm not a candidate for knee surgery because I do have cartilage in there. I have arthritis, so I'm kind of in limbo. I
Right.
can't do a knee replacement, but I don't want to be in constant pain.
Sure.
And I want the mobility, because you don't realize until you can't walk how limiting. I mean, to get up to go to the washroom or to get up and fix yourself something to eat was, difficult,
Okay.
So I do recommend it, absolutely. At least give it a try.
Thank you very much for coming on the program. If you or a loved one are suffering with chronic degenerative knee pain, please take down the phone number below. If you're suffering with knee pain and if you've tried injections, you're taking pain pills, or you might be facing a knee replacement surgery, take down the phone number. I guarantee results in 2 visits, or I don't take you on as a patient. If you mention this program, the cost will be $60. We will do a full evaluation. Our normal fee is $250. So for $60, I can rule you in or out of care. Thank you very much.